I'm Craig Radnay. I'm a board-certified orthopedic surgeon with advanced fellowship training in foot and ankle surgery and post-traumatic reconstruction, as well as knee reconstruction and sports medicine. Most of my training was actually in the Northeast, and eventually I did 2 fellowships. One was up in New York at Columbia University, and then I came down here to the Florida Orthopaedic Institute. And now it's been 16 years I was in practice in New York City, and I'm really excited to come back to Tampa. Every day I get to meet new people. I get to try and help make people better and make them improve their quality of life. So for me, that's very rewarding. I try and obviously have a patient come in, and I want to find out why they're suffering. I want to try and diagnose them. And then I want to try and recommend a treatment plan that's appropriate for that specific patient and diagnosis. Because I've done extensive training and did the 2 fellowships, I tend to see a little bit more of a wider variety. I think it also gives me a wider perspective so that I can handle all of their conditions. Really anything involving the knee, from fractures to sports to total joint replacement, revision joint replacement, and then all the way down the leg to the foot and ankle for ankle replacement, flap for reconstruction, sports injuries, bunion surgery. With every patient it's different, and that's actually one thing I really like in orthopedics is that with each problem there's not only necessarily one solution. And so certain patients may need shoe wear or activity modification, and other patients may need medication or an injection or some type of biologics like stem cells or PRP, which I do. Other patients may just need some physical therapy, and other patients may need surgery, and some patients surgery may actually be the conservative treatment. So I find that rewarding to have those discussions with patients and we come up with a plan together. I think we all know how important it is to have an active lifestyle and the importance of that on everyone's general health. So it's really our responsibility to help get patients better, get them back on their feet, get them the best possible short and long-term outcomes to improve their quality of life.